you, members. I now recognize the clerk. Please call the roll.
Representative Tata?
Present.
Representative Tata?
Present.
Representative Lina Babalta?
Present.
Representative Sheila Babalta?
Present.
Representative Blanco?
Present.
Representative Joel Komatsu?
Here.
Representative Vicente Komatsu?
Present.
Representative Demapan?
Here.
Representative Flores?
Present.
Representative Guerrero?
Yeah.
Representative Lizama?
Present.
Representative Mongolia?
Present.
Representative Probst?
Present.
Representative Cristina Sablan? Present. Representative Jean-Paul Sablan?
Here.
Representative San Nicolas?
Present.
Representative Stafford? Present. Representative Gomez? Mr. Speaker?
Present.
Representative Yankuman?
I'm here.
Representative Newell?
Present.
Mr. Speaker, all 20 members are present.
Thank you, clerk. With all 20 members present, constitutes a quorum, and we proceed. We now move on to item number 2, public comments. The floor is now open to receive comments. Please try to limit your comments to 3 minutes. And please state your name and the entity that you represent. Thank you.
Good morning. My name is Helen Sablan, the Medicaid Director. I'm representing the Commonwealth Medicaid Agency. Good morning, Speaker and members. Thank you for the opportunity to be here and to provide support for and comments on HJR 22-4, HB 22-48, and HB 22-53. All 3 measures are important to the Medicaid program and the thousands of Medicaid beneficiaries that are provided health insurance in the Commonwealth and Northern Mariana Islands. I would like to thank all the members of the Cinema House of Representatives for sending your letters of support to the U.S. House of Representatives requesting parity between states and territories in the Medicaid funding. The Commonwealth Medicaid Agency appreciates the ongoing concern of the legislature for the Medicaid program in the Commonwealth of the Northern Mariana Islands. The Commonwealth Medicaid Agency strongly supports and is in dire need for the passage of the Joint Resolution 22-4. The CNMI received approval from the Centers for Medicare and Medicaid Services effective October 1, 2020 for positions needed by the Medicaid program for administration, compliance, and Medicaid enterprise systems. To date, CMA has been unable to fill the positions. As such, we strongly support this measure and urge its approval. The Commonwealth Medicaid Agency strongly supports HB 22-48. The bill will provide some additional funding for the Medicaid program to be appropriated to Business Unit 1981, Compliance and Medicaid Enterprise Systems. The legislature provided the authority for the director of the Medicaid program to transfer funds within the 3 business units. Unfortunately, while the authority was provided, no funds were placed in Business Unit 1981 due to a conflict with another part of the CNMI code. The legislature needed to initially authorize an amount for the new business unit that was established by the legislature in the CNMI FY 2021 Appropriations Bill. As a result, the Medicaid program requests that any initial additional appropriation for the Medicaid program be placed in Business Unit 1981. The Commonwealth Medicaid Agency strongly supports HB 22-53 for the following reasons. Increase the funding in an unspecified amount to be determined by the legislature for the Medicaid program for FY 2021. Codify the expenditure authority of the Medicaid program to transfer funds among the 3 business units as the director of the Medicaid. Require the Medicaid director to report to the legislature the reasons for any transfer of funds. To help ensure that the Medicaid program is able to recruit and retain qualified personnel for the largest health insurance program in the Commonwealth. The bill would require the Office of Personnel Management to undertake a classification and compensation repricing study for the Medicaid personnel, using the Commonwealth Healthcare Corporation as a reference point for the classification and compensation review of like positions and compensation. Amend PL 21-28 to enable the limited term employees to remain in place until the classification and compensation study is completed, and amend 1 CMC Section 8248
to include the manager of the Medicaid enterprise systems to be an accepted position and compensated higher than the current salary cap. Thank you, members, for introducing the joint resolution and bills to address the Medicaid program challenges. Should there be any further questions, please do not hesitate in letting us know.
Thank you, Ms. Sablan. Floor is still open for public comment.
Privilege, Mr. Speaker.
Recognize.
Could we please get a copy of Ms. Sablan's written statement?
Sure.
It's already been submitted.
Oh, it's been submitted. Thank you. Thank you. Floor is still open for public comments. Again, please state your name and the entity you represent. Thank you.
Good morning, everyone. I'm Jodina Atal, and I'm here today on behalf of NMTI and the many staff who so willingly and diligently take time out of their day to voluntarily help out around the facility. It is very apparent that we all truly believe we are contributing to an educational, skills building, and capacity enhancing cause. We understand that change is hard, that the transition was a tedious and challenging effort for all, and we commend and respect all those who work tirelessly to try and make the transition as seamless as possible. However, a few but huge immediate needs were left out of the transition plan that we urge you to calendar today. One is the establishment of a business unit through an appropriation because the NMTI line item was vetoed in October of last year before I came on board. Currently, NMTI cannot be transferred even $1 to get started until we have that appropriation for fiscal year 2021. Two, please pass the House Joint Resolution for 28 FTEs for NMTI administrative and instructional functions so we can get the school running and open for enrollment. Until these steps happen, we are unable to reopen. Thank you, Representative Staffler, for your leadership and guidance in navigating the system as we work to open the school back up to the many people who have walked through our doors looking to enroll. It's been a month since I've been appointed interim CEO. I've attended countless meetings and collaborations to ensure NMTI is playing an active role in building trust and rapport with various partners, as well as build upon my knowledge on workforce development plans. The CNMI is blessed with such resilient and dedicated people who continue to work hard towards systematic alignment, leveraging of resources, and sustainability planning. We're excited for the new up-and-coming team. Thank you.
Thank you, Ms. Atal. Floor is still open for public comments.
So good morning, honorable members of the House. My name is Sharnessa Lizama. I am the Tobacco Prevention and Control Program Coordinator at the Commonwealth Healthcare Corporation. Tobacco is an issue. Globally, tobacco is the leading preventable cause of death. It is the 6th of the 8 leading causes of death. According to the Center for Disease Control and Prevention, worldwide tobacco use causes more than 7 million deaths per year. If the pattern of tobacco use doesn't change, more than 8 million people will die from disease related to tobacco use by 2030. The World Health Organization states that increasing tobacco taxes is an effective strategy in reducing tobacco prevalence rates, such as reducing relapse among those who have quit tobacco and reducing consumption among continuing users. In 2012, the Philippines successfully raised their tobacco taxes. The government generates a bigger revenue, and 85% went to health coverage and improved healthcare facilities. It is said that higher prices increase the likelihood of quitting tobacco and prevents initiation of tobacco use among our youth. In tobacco use among youth in the CNMI, cigarettes and cigars have decreased, but smokeless tobacco and vapor products have significantly increased. This is alarming as it puts our youth at risk of becoming dependent on nicotine and developing tobacco-related health issues. Allowing price interventions such as increasing tobacco taxes can reduce the likelihood of our younger generation from nicotine addiction and tobacco health-related issues. What does this mean for the CNMI? Referencing the 2016 NCD hybrid survey, 104 adults currently smoke cigarettes, and 1 out of 5 adults chew Bittleman, and majority add tobacco to their chew. The data clearly states that our people are currently suffering from various non-communicable diseases such as cancer. We are seeing individuals below 40 diagnosed with stage 3 or stage 4 cancer. We are seeing our children live a life without their role models and parents not having the opportunity to live long to see their children grow. Overall, decreasing tobacco use will help save lives of our present and future generations to come. Thank you.
Thank you very much. Floor is still open for public comments.
Good morning, honorable members of the House. My name is Hannah Isabel Shai, the Diabetes Prevention and Control Program Coordinator at the Commonwealth Healthcare Corporation. As previously mentioned, increasing tobacco taxes decreases tobacco use. Decreasing tobacco use on a population level improves health outcomes, especially for chronic disease such as diabetes and heart disease. So this isn't just about tobacco use. Smoking increases the risk for diabetes by up to 40%. For those in the CNMI who are already diagnosed with diabetes, smoking decreases the effectiveness of treatments such as insulin, which makes it even more difficult to manage the disease. In addition, diabetes complications are more likely to occur and are much worse with smoking. These complications, such as amputation, kidney disease, and heart attack, are already prevalent in our community. CHCC data from 2019 estimates that 43% of patients diagnosed with diabetes have stage 3 chronic kidney disease or greater. Tobacco use further exacerbates these issues, causing burden to the health system and the quality of life for our people. Not just for those patients who have chronic kidney disease, but for their families and caretakers. In addition, 21% of heart disease deaths are caused by tobacco use and secondhand smoke exposure. These deaths are completely avoidable. Eliminating tobacco use could save 2 of every 10 people diagnosed with heart disease, not only for those who smoke, but also for those who are exposed to secondhand smoke. It is estimated that heart disease risk increases by up to 30% solely from secondhand smoke exposure. Overall, decreasing tobacco use will greatly improve health outcomes in the CNMI, not only for current tobacco users, but for everyone. Thank you.
Thank you very much. Floor is still open for public comments, and if you do have written comments, please feel free to submit it to the House Sergeant at Arms. Thank you. Please proceed, ma'am.
Good morning. My name is Caitlin Nyquist-Mapano. I'm the Special Assistant for Policy, Sustainability, and Development at the CHCC. The CHCC is a devoted advocate for policy which furthers public health objectives and positive health outcomes. The purpose of HB 2254 is to bring tobacco taxes to the recommended level, tie the tax rate to inflation, and invest revenues from the tax into health promotion and disease prevention. All these objectives are best practices of tobacco control through taxation. Thanks in large part to stronger policies such as tax increases in the Smoke-Free Air Act, smoking is on the decline in the CNMI. From 2011 to 2016, adult cigarette smoking reduced from 28% to 25%. This may not sound like much, but that is more than a 10% reduction in the use of a highly addictive product. That's what we call a public health win. We know that about 80% of betel nut users in the CNMI who add tobacco to their chew use cigarettes to do so. Betel nut use declined in 2016 by roughly 21% from the rate of use in 2011. That's huge. Among CNMI youth, there have also been significant declines in the use of cigarettes, from 1 in 4 of all high school students in 2011 to 1 in 10 of all high school students in 2019. But smokeless tobacco, as Chenny alluded to earlier, and vapor products continue to be pervasive in CNMI high schools. These reductions are the result of a confluence of public health solutions, including education on the harms of tobacco and betel nut, tobacco cessation support, the creation of more smoke-free environments, and of course, increased tobacco prices. These public health successes in the CNMI ought to be celebrated, but we're not quite there yet. Our rates of tobacco and betel nut use are still far too high, and the health consequences remain painfully evident in our community. House Bill 2254 would bring tobacco taxation to the evidence-based level to maximize public health, and the proposal to significantly increase the proportion of tobacco taxes which go to health promotion, education, services, and systems changes is not only in line with tobacco control best practices, but this funding assurance would also be a testament to this body's vision for a healthier CNMI. Thank you.
Thank you very much. Floor is still open for public comments.
Good morning, representatives. My name is Amber Mendiola, and I am here in my capacity as a community member, speaking in support of House Bill 22-54. For the last couple of decades, leaders in our Commonwealth have been well aware of the health concerns that keep becoming more disconcerting because of non-communicable diseases. When you look back to the 11th legislature, you'll see that laws were enacted to combat NCDs even since 1998. Leaders then already noticed that this was going to be an issue. But support for this has been extremely inconsistent. The laws were passed, but the money was rarely used for what it was supposed to be used for, which was prevention. Look back at the expenditures for, let's say, the Tobacco Control Fund, and you'll see that since 2002, the CHCC, then the Commonwealth Healthcare Center, received funding once, maybe twice indirectly. Most of the funding went to related works with medical referral and Medicaid, and other funding went to COC, building more government buildings, and then the general fund. I feel like the good intentions were there, but the follow-through definitely was not. The World Health Organization, the U.S. Department of Health and Human Services, and a number of well-known nonprofit organizations have proved with wealth of knowledge and literature that increasing tobacco taxes does reduce the burden of chronic diseases in disparate populations, most especially rural communities such as our Commonwealth. Diseases caused by tobacco use are undoubtedly 100% preventable. Several years ago, WHO did a return on investment study with countries that supported cancer prevention. It found that for every $1 spent on prevention, $3 was saved on treatment. That is a considerable amount of money saved when you look at how much treatment costs are. Leadership in the CNMI is constantly saying, apply for grants, look for other means. But what are we going to do if the CDC were to, let's say, shut down tomorrow? How are we going to support the health improvement of our people? We need an alternative funding stream, one that doesn't take away opportunities to make healthier choices, one that doesn't promote unhealthy environments. And I believe we found it. But it's not enough to enact a law. This body needs to ensure that the money is going to programs and services that will address environmental and systematic changes to improve the health of our people. Our people are becoming sicker by the minute. We say it's an individual choice to eat what you want, exercise when you want, chew, smoke. But also, we as a comprehensive system do not provide opportunities to make better choices and have better environments. In 2016, the CNMI was the first Pacific Island country to conduct an adult hybrid population health survey that included blood sugar, blood pressure, and body mass index. What did the data tell us? It showed us that more than 50% of the adult population in the CNMI have high blood pressure. 1 out of every 4 adults smoke, and to add, about 2 out of 4 smokers have comorbidities. This means that, for example, for the 20 of you that are sitting here in the chamber, about 5 or 6 of you, maybe even more, probably use tobacco. This also means that a few of you in this chamber also have comorbidities such as diabetes, hypertension, and heart disease, and then, including to that, use tobacco.
Sure.
Today, about 7 out of 10 deaths that occur in the CNMI are due to NCDs or related risk factors such as tobacco use. In 2012, a physician that was then with the CHCC did an informal assessment and found that almost 50% of our youth are overweight or obese. A third of the youth population will have a chronic disease by the time they're in their mid-20s and would probably pass away by the time they're in their mid-40s. And that's way before the average life expectancy of 70 years old for Pacific Islanders. This is highly alarming because this tells us that if we were to gather all the kids in the CNMI, ages 0 to 17 years old, and put them in the field outside, about a third of them would have a chronic disease by the time they're in their 20s and pass away at an early age. And I mean all kids. Yours, your grandkids, nieces, nephews, and my kids. I don't want to be putting so much effort into boosting tourism and changing the name of government agencies when we're not fostering healthier communities. Because it means that our kids won't live long enough to even notice. Sadly, this also means, and the data is telling us, that in the CNMI, this will be the first generation of kids who will be buried before their parents. That's not how the cycle of life is supposed to go. Maybe some of you in this chamber know my health story. I have a congenital heart disease. It means I was born with it. And data tells me that the average lifespan with a person who has a condition like mine is about 30 years old. They tell me that maybe I won't live long enough past 50. They told me that I would not be able to have a baby, that maybe if I did get pregnant, myself or my baby would pass away. In 2017, I gave birth to a healthy baby boy who's almost 4 years old. And for some of you that have boys, you know he's already smelling like toro. I want to be able to raise him here. I don't want to raise him anywhere else. And you know, now that I think about it, there's a lot of you in this chamber that have been supportive towards myself and my family throughout my health journey. So I thank you for that. I want to raise him here. This is our home, but it's difficult to raise him in a place that doesn't provide him with opportunities to live his best life. We need to work together. Health should be everyone's business. Increase the tobacco taxes, make the healthier choice the easier choice, but make sure that the funds go where they're supposed to programs that will continue to combat NCDs, programs with workers who are passionate about improving the quality of life for our people, and to continue services that will aid tobacco prevention and control. NCDs are the most significant health issues in the world, surprisingly bigger than COVID, but only receives a fraction of the funds that we get for COVID relief. And to relate, NCDs are also the most significant health issues in the CNMI. Support this bill, support health, because at the rate we're going to see our people dying younger and younger, and maybe it doesn't hit now, but when you see a close family member, maybe even yourself, a close friend with an NCD suffering, going through treatment, you look at their caregivers and see what they're going through, you'll think back and wish you could have done something. Do something now. Support and pass this bill. Thank you.
Thank you, Ms. Mendiola. Floor is still open for public comments.
Good morning. Good morning, distinguished members of the 22nd Legislature. My name is David R. Martita. I'm the Director for the Alcoholic Beverage Tobacco Control on the Department of Commerce. I'm here on behalf of the Acting Secretary, Mr. Edward De Leon Guerrero. We didn't come here with a prepared comment, but we would like to assure this body that our support goes with, in partnership with CHCC with respect to House Bill number 22-54 on the tobacco tax. Moving on along that, we would also like to thank Representative Laila Staffler for the House Bill 22-55 with respect to the online licensing for the sale of alcoholic beverages. But since this one will be introduced today, we will be looking forward to the solicitation of comments, and we are happy and, we'll stand ready to provide our comments with respect to that bill. So that, thank you very much.
Thank you, Mr. Maratita. Floor is still open. Okay, if there's no further public comment, we now move down to item number 3. Before we adopt the agenda, I'd like to recognize the floor leader for the suspension of rules to allow for bills and communications that did not make the 72 hours. Floor leader.
Thank you, Mr. Speaker. And I'll offer a motion to suspend Rule 3, Section 6, notices of session. So moved.
A motion has been made by the floor leader and has been seconded. Discussion on the floor. Ready? Clerk, please call the roll.
Representative Vada?
Yes.
Representative Vaca?
Yes.
Representative Selena Babalta?
Okay.
Representative Sheila Babalta?
Again.
Representative Blanco?
Yes.
Representative Joel Camacho? Representative Vicente Camacho?
Yes.
Representative Delapan?
Good.
Representative Flores?
Yes.
Representative Guerrero?
Good.
Representative Lizama?
Yes.
Representative Gloria?
Yes.
Representative Pro?
Yes.
Representative Cristina Sablan?
Yes.
Representative Jean Paul Sablan?
Good.
Representative Sonny Claus?
Yes.
Representative Stafford?
Yes.
Representative Yantaman?
Aware.
Representative Lugo?
Yes.
Mr. Speaker?
Yes.
Mr. Speaker, all 20 members voted yes.
With 20 members voting yes, the motion is hereby adopted. We now move to the adoption of journals. I recognize the clerk.
Mr. Speaker, under item 3, adoption of journals, we have one item, third day, first regular session journal dated March 16, 2021.
Thank you, clerk. I now recognize the floor leader for the proper motion for the adoption of journals.
Thank you, Mr. Speaker. And with that, I now offer a motion to adopt third day, first regular session journal dated March 16, 2021. So.
Second.
The motion has been made by the floor leader and has been seconded. Discussion on the floor. All in favor for the adoption of the journal, please say aye.
Aye.
All opposed, say nay. The ayes have it. Third day, first regular session journal is hereby adopted. We now move to item number 4, introduction of bills, and I recognize Representative Donald Monroe.
Thank you, Mr. Speaker. Officially introducing House Bill number 22-48 to amend Public Law 21-35 to make appropriations for the operations and activities of the government of the Commonwealth of the Northern Mariana Islands, its agencies, instrumentalities, and independent programs, and to provide budget authority for government operations for fiscal year 2021 and for other purposes, introduced by myself and several others and open for co-sponsors. Thank you.
Thank you, Representative Manglonia. House Bill 22-48 will be referred to the Committee of Ways and Means. I now recognize Representative Richard Lizama.
Thank you, Mr. Speaker. I'm officially introducing this bill, House Bill number 22-49, provide a voluntary incentive to business establishments to install closed-circuit television cameras. It's been filed by myself, and I still ask for co-sponsors. Thank you.
Thank you, Rep. Lizama. House Bill 22-49 will be referred to the Committee of JGO. Please proceed.
Thank you, Mr. Speaker. House Bill number 22-50, I'm officially introducing this bill to amend Title 9, Division 2, Chapter 1, subsection 2104 of the Commonwealth Code to have all trailers in the cinema registered in order to be operated on public streets and for other purposes. I introduced by myself and I ask for co-sponsors. Thank you.
Thank you, Representative Lizama. House Bill 22-50 will be referred to the Committee of JGO. I now recognize Representative Joseph Flores.
Thank you, Mr. Speaker. I still formally introduce House Bill number 2251 to amend ICMC subsection 4101 to add new subsections F, G, H, I, J, and K to have restriction related to the colors of headlights, signal lights, and brake lights on vehicles and for other purposes. Introduced by myself, and I welcome other members to co-sponsors. Mr. Speaker.
Thank you, Representative Flores. House Bill 22-51 will be referred to the Committee of JGO. I now recognize Representative Vipan Guerrero.
Thank you, Mr. Speaker. This is to officially introduce House Bill 22-52 to amend 1 CMC, subsection 2806C, to provide flexibility in negotiating public land, rental amounts for hotel and golf course. Introduced by myself and welcome other members to co-author. Thank you, Mr. Speaker.
Thank you, Representative Guerrero. House Bill 22-52 will be referred to the Committee on NR, Natural Resources. I now recognize Representative Leila Stafford.
Thank you, Mr. Speaker. I am introducing House Bill number 22-53 to appropriate funds for the Commonwealth Medicaid Agency to ensure that federal appropriated and awarded funds may be expended for program administration, reimbursements to medical providers, and for compliance and Medicaid enterprise systems, and further enable recruitment, retention, and appropriate classification and compensation of personnel. I am offering it and invite others to co-sponsor.
Thank you, Representative Staffler. House Bill 22-53 will be referred to the Committees on Ways and Means and Health and Welfare. I now recognize Representative Cristina Sablan.
Thank you, Mr. Speaker. Introducing on behalf of myself and others and welcoming co-sponsors, House Bill 2254 to update the definition of tobacco products in the CNMI's excise tax laws, bring tobacco tax rates to the recommended level, set tobacco tax rates to increase with inflation, and invest tobacco tax revenues in health promotion and disease prevention and control programs for the CNMI and for other purposes.
Thank you, Representative Sablan. House Bill 22-54 will be referred to the Committee on Ways and Means. I now recognize Representative Leila Stafford.
Thank you, Speaker. I introduce House Bill number 22-55 to amend 4 Commonwealth Code 5526 to establish a separate license for online sales of alcoholic beverages, and I welcome others to co-sponsor.
Thank you, Representative Staffler. House Bill 22-55 will be referred to the Committee on Commerce and Tourism. I now recognize Representative Sheila Gamalta.
Thank you, Mr. Speaker. I'd like to officially introduce House Bill 22-56 to assess a fee on plastic checkout bags distributed in the Commonwealth and for other purposes, authored by myself, and I welcome co-sponsors. Thank you.
Thank you, Representative Gamalta. Your House Bill will be referred to the Committee on Commerce and Tourism. And I'll recognize the floor leader.
Thank you, Mr. Speaker. I'm now introducing House Bill 22-57 to provide a tax credit for business entities that hire U.S. citizens or residents of CNMI whose employment was affected by COVID-19, offered by myself, Speaker, and the Vice Speaker, and also I'm open to co-sponsors. Thank you.
Thank you, floor leader. House Bill 22-57 will be referred to the Committee on Ways and Means. We now move down to House local bills, and I recognize the Vice Speaker.
Thank you, Mr. Speaker. Officially introducing House Local Bill number 22-7 to appropriate $1,446,000 from revenues collected pursuant to Saipan Local Law 11-2 as amended and for other purposes, introduced by myself and several others, and I welcome all the members from the 3rd Senatorial District to please co-sponsor the legislation. Thank you, Mr. Speaker.
Thank you, Vice Speaker. I now recognize Representative Floor Leader Ralph.
Thank you, Mr. Speaker. I'm now offering also House Local Bill 22-8 to impose a local fee on all non-gaming all non-poker electronic gaming devices within the 3rd Senatorial District and for other purposes. And I also welcome all members of the 3rd Senatorial District to join this endeavor. Thank you.
Thank you, Floor Leader. We now move down to the introduction of resolutions, and I recognize Representative Stafford.
Thank you, Mr. Speaker. I'm introducing House Resolution 22-6 to commend Maria Palacios Muñoz for her time-honored legacy of dedication, enthusiasm, and outstanding public service given to the Commonwealth of the Northern Mariana Islands for the past 30 years, but it is actually 49. And please forgive me. If there are no objections, I would like to introduce this as a committee as the whole. Thank you.
Thank you, Representative Leila Staffler, and thank you for offering it for the committee as a whole. Please proceed.
Thank you, Speaker. I am offering this House Resolution number 22-7 to honor and commend Ms. Jane Mack for her lengthy service and extraordinary contributions to the Commonwealth of the Northern Mariana Islands. And if there are no objections, I would like to offer this as, to introduce this as a committee as a whole.
Thank you, Representative Staffler. I now recognize Representative Angel Demapan.
Thank you, Mr. Speaker. This time I'd like to introduce House Resolution 22-8 to encourage Governor Ralph D.O.G. Torres and CNMI Delegate Gregorio Kilili Camacho Sablan to submit to the President of the United States their recommendation for the renomination of the Honorable Ramona Villagomez Manglone to serve another term as Chief Judge of the U.S. District Court for the Northern Mariana Islands and to recognize her for her distinguished career. Offered by myself and several others, and if there are no objections, I'd also like to offer this as committee as a whole.
Thank you, Representative Demapan. Members, all House resolutions will be placed on today's calendar. Thank you. We now move down to the House Joint Resolution. I recognize Representative Staff.
Thank you, Speaker. I am introducing House Joint Resolution number 22-3 to respectfully urge the Honorable Governor Ralph De Leon Guerrero Torres to reallocate necessary funds generated by the fees paid for by prospective employers of foreign non-immigrating workers to the Northern Marianas Technical Institute. Thank you.
Thank you, Representative Staffler. I now recognize, please proceed.
And if I may return back to the when, if there are no objections, I would like to introduce this as a committee as a whole. I apologize for
Thank you, Representative Staffler.
Thank you for your grace.
Please proceed.
Thank you. I am introducing House Joint Resolution 22-4 to authorize the establishment of an additional 16 positions as needed by the CMA and partially funded by the CMS Program for Compliance and Medical Enterprise Systems, MES, and for other purposes. And if there are no objections, I would like to introduce this as a committee of the whole. Thank you.
Thank you, Representative Staffler. Please proceed.
Thank you, Speaker. I am offering to introduce House Joint Resolution 22-5 to authorize the establishment of an additional 9 positions as needed by the Northern Marianas Technical Institute and for other purposes. And if there are no objections, I would like to offer this, to introduce this as a committee of the whole. Thank you all.
Thank you, Representative Staffler. All House Joint Resolutions will be placed on today's calendar for action. Under House Commemorative Resolutions, we have none. House Concurrent Resolution, I recognize Representative Donald.
Thank you, Mr. Speaker. Officially introducing House Concurrent Resolution number 22-1 to approve revenues and resources of the Commonwealth of the Northern Mariana Islands as identified pursuant to Article 3, Section 9A of the Constitution as amended and 1 CMC Division 7 for fiscal year 2022 beginning October 1st, 2021 and ending on September 30, 2022, offered by myself. Thank you, Mr. Speaker.
Thank you, Representative Magnolia. House Concurrent Resolution will be placed on today's calendar, resolution calendar. Thank you. We go down to item number 6, messages from the governor, and I recognize the clerk.
Thank you, Mr. Speaker. Under item 6, messages from the governor, we have Governor's Communication 22-25, all the way through Governor's Communication 22-29. 22-29 has been added by the House.
Thank you, Clerk. Any discussion on the Governor's communication? Recognize Representative Sheila Babau.
Thank you, Mr. Speaker, and colleagues. I first want to begin with Governor's Communication 22-28, Executive Order number 2021-07, where the Governor renews a declaration of state of public health emergency. And it is cited in Article 3, Section 10 of our CNMI Constitution that the Governor does have emergency powers. Stated in our Constitution, the Governor may declare a state of emergency in the case of invasion, civil disturbance, natural disaster, or other calamity as provided by law, and may mobilize available resources to respond to that emergency. Now, in Executive Order 2021-08, that's Governor's Communication 22-29, it's the one that was placed on our desk. This executive order is renewing the authority of the Secretary of Finance to reprogram or transfer funds from accounts of any department, agency, office, board, commission, corporation, instrumentality, or other entity of any branch of the Commonwealth government in order to meet the threat of COVID-19. Now, Mr. Speaker and colleagues, I, along with many members of the community, are still very concerned about this extreme level of power granted to the Secretary of Finance. We have all faced this pandemic together for over a year now. And according to our law, the Planning and Budgeting Act already grants reprogramming authority to all department heads up to 25%. Mr. Speaker and colleagues, now that we have been through this pandemic for over a year, and we are expecting a massive amount of federal funding, I am extremely concerned about this renewal of power of reprogramming authority because it's unlimited. And colleagues, I know that we all get calls from many of our public servants in different departments in the executive branch who are wondering where their budget is going. They have lack of vehicles, lack of fuel to even complete the minor projects for their departments. They have lack of paper, lack of like the most simplest things needed to run a department, to serve our community. These are public services. And so, Mr. Speaker, my concern is with Governor's Communication 22-29. And I would like to request that it be rejected or sent to committee for further research and deliberation, that we not accept it. Can I clarify with our legal counsel on how we would go about that? Will I need to offer a motion to send this to committee or to simply reject? Yes, I'm asking legal counsel. Thank you, Mr. Speaker.
Recognize. Quick recess.
This is unprecedented. We have 60 days to act. We don't know the process that's drawn out. What to do. Process, and if you don't act within 60 days of today, it passes automatically. But she has a point. It doesn't necessarily jive with the current circumstances, but it's arguing. One person's emergency is another person's things are
You know, when bringing up the issue about the salary